Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echovascular, general, high risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Today, our special guest is Jeff Hernandez. He currently works as a clinical application specialist for LumiBird Medical, the world's leading manufacturer of ophthalmic ultrasound and lasers. Prior to joining LumiBird Medical, he worked for 13 years as a diagnostic ophthalmic ultrasonographer to two university hospitals, Department of Ophthalmology. He knows the ins and outs of ocular anatomy and pathophysiology, as he also taught ophthalmology residents and fellows, as well as other ophthalmic technologists on how to perfect their ultrasound technique. One of his greatest passions is teaching, especially when it comes to diagnostic ultrasound. He is currently active in teaching workshops and lectures through various organizations such as the Ophthalmic Photographer Society and the Joint Commission of Allied Health Personnel in Ophthalmology. Please help me welcome Jeff Hernandez. Thank you, Jeff, for coming on and talking to us about this exciting topic, one that I don't know anything about, but it's pretty fascinating. After talking with you. So tell us first a little bit about yourself.
Sure. First of all, thank you so much for having me. One of my biggest things is I love talking about what I do because, as you mentioned, not a lot of people know about ocular ultrasound. But I've been a sonographer for over 13 years now, and I didn't start off in ophthalmology. I think a lot of people tend to question like how does that happen? How does one get into ophthalmology? I started in OBGYN, kind of like the bread and butter of ultrasound, if you want, if you will, you know. But I think one of the most fascinating journeys for everyone, for anyone in ultrasound, is how did you find your specialty, or how did you come about? And I think mine is one of what I call pure luck. I think you have a different term for it,
I
but
call them divine appointments, but
design
yeah,
appointment.
a little bit of the same.
But I certainly would love to talk about it some more.
Awesome. Awesome. So why ophthalmology?
So ophthalmology is, I think, and maybe it's my own biased opinion, but one of the most unique medical and surgical subspecialties in medicine. And, you know, when people think of ultrasound, they think of OBGYN or cardiology or even emergency medicine. And ophthalmology isn't really one that kind of trickles into the world of ultrasound. But ophthalmology being a very tech-savvy specialty, ultrasound is widely used, believe it or not. And so, even though the eye is a very, very tiny organ, it has 12 subspecialties. And within those subspecialties, ocular ultrasound is widely used.
Wow. Um, tell us how specialized it is. Like I think we were talking earlier and you said something about 36 something. Um,
Ultrasonographers, right?
yeah.
Yeah,
That right?
definitely. So the world of ultrasound in general, it's small, but when you account for the very specialized or very niche specialties, I mean, it's even smaller. To my knowledge, there's only 36 comprehensive ophthalmic ultrasonographers in the country. Sure enough, there's some that are up and coming with training and all that good stuff, but those of us that are kind of established, it's a very handful of us. And I mean, compared to the whole US or even world, I mean,
Right.
it's a very, very small knit community.
Yeah, so you think of double digits, right? Like 36. I mean, that's such a small number compared to like those of us who are in OB or high risk OB or,
Right. Right.
echo or things like that. Like, yeah, it's a very niche kind of specialty, which is
Very much so.
fun. Kind of fun. It really kind of puts you to the top of it pretty quick then, right?
Yeah, definitely, definitely.
So tell us your fun story of how you got into ophthalmic
Ophthalmic
ultrasound.
ultrasound? Sure, sure. Well, so I was finishing up my ultrasound program. And of course, one of the rotations was maternal fetal medicine, which at the time I was so sure that that's what I wanted to do. I wanted to do MFM so bad. And sure enough, I was excited to go to my rotation and I get there and well, one of my first patients was a mom of twins. And I'm about to do the scan and I start and I couldn't find a heartbeat on either one of the babies. And surely I thought, I'm like, well, maybe it's just me. I'm novice and maybe I'm just nervous. Who knows?
Hmm.
And moms are very intuitive. It's from what I've learned. Moms are very intuitive and they know when something's not right. And so the mom kind of kept trying to look over at the screen and I'm kind of like, trying to shy away. Um, and she's like, I can't hear the heartbeat. Is something wrong? And they tell us in school, poker face, don't show any emotions, things like that. And so I told her, well, I'm a little new to this. Let me get the physician to come in and take a quick little look. Um, and sure enough, the physician did the ultrasound, and unfortunately, neither one of her babies were viable. They passed away. And I mean, I can remember the emotion, and I was like, I don't know that I can handle this. I don't know that this is something that I can do for a living. And props to those sonographers who do this for a living, who work with moms and unfortunately sometimes have to go through the bad and the ugly because I mean it was really emotional even for me. I went home that day and I was like, am I in the right field? Did I do this right?
Right, right.
But anyway, after that, I went to the NICU and I was scanning baby brains, and just out of pure luck, there was a pediatric ophthalmologist who was doing her rounds, and she requested an ultrasound on one of the baby's eyes. And so I overheard that, and I'm thinking, did I hear that right? Did she just say she wanted an ultrasound of a baby's eye? And so I went up to her. I, mustered up the courage to go talk to her, and I said, "Would you mind if I observe? I in school they don't teach us about ocular ultrasound, and I'm curious to see what you're looking for." And she says, "Sure, sure, tag along." And so, sure enough, she does an ultrasound, and she was kind of explaining, this is the retina, the optic nerve, and things like that. And I was like mind blown. I was like, "Wow." And I think I told you earlier, in retrospect, now that I look back at her ultrasound abilities, I'm like, okay, that really wasn't a really good ultrasound. I think
Right?
but at the moment I was like mind blown. And so I asked her how can I get into this kind of field? And she said, well, in reality, ophthalmologists are the only ones that really do their own ultrasounds because it's so niche. But she goes, let me talk to the medical director and see if maybe we can get you a spot. And luckily, he agreed, and I joined the Department of Ophthalmology. This was in Houston years ago, and they sent me to the University of Utah to do like a mini fellowship. And I trained with a wonderful physician, Dr. Roger Harry, who taught me about the ins and outs of ocular ultrasound. And till this day, I'm very, very grateful for that.
Awesome. Divine appointments. That's what I call that. Right? I think when you're curious, when you follow your curiosity, I think there's something to that, right? It's kind of like following
Absolutely.
your joy, right? Like there was something that really called you to ask about that or want to watch it or, to
Sure
follow
thing. Sure
and
thing.
to get curious about things and then to follow what makes you curious or joyful about that, I think is part of our journey. So
Absolutely.
I appreciate you sharing that. So, can you tell us a little bit about what is ophthalmic ultrasound and
Sure
how do
thing.
you do it and all that kind of fun stuff?
Absolutely. So we actually use our own probes. We have specialized ophthalmic probes. So with that comes very specialized machines. And as you may know, within ultrasound yourself, they come in different ranges, megahertz. And so we typically use between 10. Some go a little bit lower to like around 8, depending on what we're looking for, to even up to 50 or 80 megahertz, depending on what part of the eye we're looking at. And so I brought a little friend here to kind of demonstrate
Okay, I
things
love
that
it.
I do. And so we typically use what we call a B scan probe, B for brightness, to look inside the eye itself. And
Okay.
typically these probes will run from about, I've seen some go from 10 and the highest that I've seen is 20. So the company that I work for at the moment, LumiBird Medical, we have a very unique 20 megahertz probe that allows me to look inside the eye to evaluate for intraocular tumors or differentiate different types of retinal detachments. I'm sure a lot of people just know the very broad term of retinal detachment, but there's actually different kinds of retinal detachments. Um, there's also a linear probe, very much like a vascular probe, that allows us to look at the anterior chamber, so the front of the eye.
Okay.
And we have a 50 megahertz linear probe, very high frequency. And we're able to see in detail the areas like the lens here, the ciliary body processes. So these little guys here regulate or make the liquid in our eye to regulate the pressure. So at times, patients with like glaucoma or things like that, we tend to evaluate this here.
Okay.
And then of course we have the iris or the colored part. Sometimes in ocular trauma, the poor little iris can just get torn or just go through hell. And so we use ultrasound to really evaluate the different structures within there. There are patients who unfortunately get intraocular tumors or tumors that invade the iris or the ciliary body here. And so ultrasonography is probably one of the best modalities to monitor, measure, and just overall evaluate the tumors.
Yeah, and I think yesterday you even said, well, sometimes there's too much fat in the eye, and I thought, fat in the eye? What are you talking about?
Right, right. So around the eye, we have orbital fat. So we have the bony area, the orbital bones, and
Okay.
within that, there's nice cushion or the orbital fat. That way,
Okay.
the eye kind of doesn't just move around and just get knocked around as we move our head and things like that.
Okay.
We
Okay.
also, of course, these lovely muscles and muscle insertions here. And
Right.
so there are times in ocular trauma or with some certain diseases, systemic disorders that can affect these structures. Thyroid eye disease is a really big one.
Hmm.
The muscles can get really, really engorged, or myositis, as we call it. The orbital fat can just get really, really, what we call fluffy, where it just gets really, really puffy and inflamed, and it's really uncomfortable for the patient. It's really painful at times, and so, of course, we can use MRI to image the orbit and the ocular structures, but in the event that, let's say, the patient is like, no, I don't want to get an MRI, or sometimes radiology, as we know, can get really backed up.
Right.
A quick and easy and non-invasive way to view the orbit is with ultrasound. And of course, you have to know what you're doing, but assuming that you do, it's pretty accurate, pretty precise.
Amazing. That's awesome. So, after we spoke, I was thinking about cataracts because in high risk OB, high risk OB, we look at the lens of the eye,
right?
right? And so a few of my colleagues have or our colleagues, excuse me, have found cataracts of the eyes. Is that something that you can diagnose as well, or?
So this is a very unique kind of branch of ultrasound that kind of mixes with both OBGYN, general pediatrics, and then ophthalmology. So within ophthalmology, one of the 12 subspecialties is pediatric ophthalmology. But then we have other specialties like ocular oncology. And so typically, of course, OBGYN, they're the ones that do the fetal evaluations. Then once the baby is born, that's when the pediatric ophthalmologists kind of go into
Okay.
their area. And if there's other irregularities like tumors, congenital tumors like retinoblastoma, then that's when the ocular oncologist gets involved. But
Okay.
in at the university where I used to work at, it was a very hands-on, very much interdepartmental kind of approach to these types of tumors where because I was trained in OB, I could do both the field evaluation and the ocular evaluation for the ocular oncologist. So
Okay.
in very rare cases with like retinoblastoma or if congenital cataracts were suspected, I was luckily able to do both the fetal and the ocular component. Mind you, I mostly focus on the ocular. The more complexities were referred to the maternal fetal medicine sonographer because that's their domain. I didn't want to step on anyone's toes.
Yeah,
But
sure.
no, it is 100% possible to evaluate for these conditions even in utero.
Okay. So what are some other kinds of diseases that you're able to detect?
For sure. So, of course, one of the big ones that I was involved in was intraocular tumors or tumors of the orbit. But in terms of ocular trauma, which actually I'm going to be at the American Society for Ocular Trauma event um, early in May, representing the ultrasound company LumiBird, where I work at, and kind of showcasing the probes and how to use these probes in the evaluation of ocular trauma. And so I remember one case very vividly where it was a little boy, 4th of July. I feel like you
Ah,
probably already know where
yes,
I'm going.
I get it.
Unfortunately, little boys are very curious with pyrotechnics, and for the firecracker didn't go off. And so, what does little Timmy do? He goes up to it, looks right into it, and poof! So he had a lot of external burns, but more so, even the tissues were damaged from the explosion. So the cornea here lost all of its nerve endings, all of its functionality essentially. So it became completely opaque or white. It was no longer functional. And even if they attempted to do a cornea transplant, it wouldn't give because there was nothing to nourish the cornea.
Okay.
Unfortunately, even so, I'm going to remove the cornea here to kind of just show you the colored part here. So even his iris, it was torn from the side here from the impact. So we call it a cleft. So there was a dialysis cleft here, and because of that, it went all the way through down to the ciliary body, where of course the fluid production is made
Okay.
and affected it. So his eye started to shrink up and shrivel or become what we call tisicle, meaning it's no longer a viable eye. And
Ah,
eventually he did have to get his eye removed.
oh, bummer.
And so he went through a serial of ultrasounds with me to evaluate, is the globe still functioning? Is the retina intact? What does the ciliary body look like? I mean, this poor little boy he went through it all. And unfortunately, this was not one of those cases with happy endings.
Right.
Um, Happily, he's alive, but
Right.
unfortunately,
Right.
there was nothing much that we could do for his eye.
Wow. Yeah. unfortunately, I uh had done some work with a radiologist who lived on a lake, and him and his best friend would shoot off fireworks every year, for the whole neighborhood.
Yeah.
And one of them malfunctioned and took his best friend's eye out, and he had to wear a patch for the rest of his life. And so the radiologist I was working for at the time refused to ever do any more fireworks
Oh,
for the
right.
neighbors because he was just so traumatized at how that happened.
Yeah, definitely, definitely.
So it's definitely a dangerous thing to mess around with.
Yeah, for sure.
So, but thanks that you have that available. So like some places don't have ocular ultrasound, so they use MRI. So how can ultrasound help over MRI, or how are they different maybe?
Sure, for sure. Well, MRI uses radio waves and magnetic fields to create these very wonderful and detailed images of certain body parts or cavities. Uh, in our case, of course, we scan the orbit and brain component to see if there's any correlation between pathology or trauma or whatever it may be. But I I'm a fairly very nice guy here. I'm Texan, and so you know we're very nice. But I am gonna boast a little bit here. Okay,
Okay.
there have been a handful of times where the radiologist can pinpoint a certain pathology, especially when it comes to some types of orbital tumors. They'll say, this tumor has this type of reflectivity, and it mostly correlates with, this pathology, comma, however, can't rule out, and then they'll list other pathologies. And so this can be a little confusing for our ophthalmologists who treat those kind of disorders because they're not like, well, what are we dealing with? How are we going to treat it? Is it will I use radiation or just an orbitotomy? That's whenever they just kind of go in there and take a look at the orbit. Um, so luckily with ultrasound, we're able to pinpoint the diagnoses. So of course, every kind of pathology has a different kind of echo pattern, and that's the same thing for the eye. The tumors have a very unique signature. And so we actually combine two types of modalities, the B scan or brightness mode, along with a scan or amplitude scan. And with these two combined, I am able to look at the topography of the tumor as well as the internal structure. And that allows me to comfortably tell the doctor, well, this is more likely a cavernous hemangioma or a hemorrhagic lymphangioma or whatever the case may be, rather than the could be this, but also this from the radiologist.
Okay.
There's other very niche and unique pathologies like there's this one called trochleitis. So we probably can't see it here, but there's a little one of the oblique muscles that kind of has a little hook up here that allows the eye to kind of rotate this way.
Okay.
Sometimes that little pulley can get inflamed and just stuck with a lot of edema and fluid.
Okay.
And a lot of radiologists, depending on, of course, where they train, aren't familiar with that pathology, and it's easily overlooked. And it's very painful for the patients. They have severe pain, headaches. I mean, it's the worst. And with ultrasound, I mean, we can easily look at the trochlea and say, hey, this trochlea is edematous. It has a lot of fluid.
Okay.
And of course, they'll go through the treatment, and honestly, it's instant relief for them once they get the treatment they need.
Okay. Awesome. So then now you are a clinical application specialist, right?
That's right. That's right.
So you've kind of switched roles. Uh,
100.
so what does that involve then as a clinical application specialist? Moving out of the clinical role to that, I'm sure that was an adjustment of some kind.
It
Um,
was. It was. So, for somebody who likes traveling, this job is ideal. I
okay.
travel a lot now. I mean, I got to go to France, where our world headquarters is at, and I got to train with amazing people. And I mean, I don't know how many people can say, "Hey, my company flew me to, France."
Right.
And so that was off the bat an amazing perk. Another perk is that I get to work with a really close colleague of mine, Beth Parrish. She's also an amazing ocular ultrasonographer. And so now I get to work with her side by side, and we just have so much fun now. But essentially, so now we don't work on patients anymore. We get to work directly with clients, accounts, so physicians and their clinical staff. And so
Okay.
let's say that you're an ophthalmologist and you say, "Hey, are in really need of a of an ultrasound device." So you make the right decision and you get one from us, right?
Right.
And we come and we not only show you the ins and outs of the device, but we also show you how to correctly use the probe. Because I know when I first started in ophthalmology, before I even started training residents, I used to see how they would do ultrasounds, and we call it, they do a quick and dirty or sloppy second type ultrasound where they just put the probe on the eye, they wiggle it around, and they're like, well, everything looks good.
Mhm.
But there's a lot more that goes into scanning an eye than just kind of wiggling the probe around. And so we convey that methodology and technique. That way, when they use our product, they're very satisfied that they made the purchase and they made the right call, and ultimately satisfied in helping other patients live happier and better lives with their wonderful eyes still intact, hopefully.
Awesome. Yeah. That's yeah, that kind of puts you at a little bit more of a eagle eye view, like looking down, right? At the whole, I know when you're an ultrasound tech and you've been at a location for a long time, you tend to have these blinders on,
Right.
that you
Tunnel
only see
vision, right?
certain ways, right? And when you get into clinical applications and you start to kind of pull away from that clinical um mind's eye, you see things a little bit differently, you know,
Absolutely.
and you
Absolutely.
see, oh, there are quite a few different areas of opportunity or things, ways to look at things, or more training that is needed, right? Like
100%. Yes.
as a traveler, I was like, oh, wow, we really could do better in some areas, right? Like,
Yes.
we need more of us, right? We need more people who know ocular. We need more of everyone, right?
Definitely. Definitely. Absolutely.
So if I was an ultrasound tech and decided I want to do ocular now instead of whatever I'm doing,
Mhm.
I'm sure well, you probably still have the fine movement, right? With your
Right.
wrists and hands that,
Right. Especially because, I mean, here my eye model is obviously enlarged for educational purposes, but if you think about it on a real patient, the eyes are pretty small. And so our movements are, sure, they can be very grossly manipulated, but also we have to make very fine movements in certain areas because the eyes are just very sensitive in general.
right,
But but yeah, I mean, I love it when I would get emails from like community colleges from students who would see these podcasts and say, is Jeff still working there? We want to send him this student that's interested in ocular ultrasound. And it's very heartwarming and it's an honor because it's something that I love to do. I love to show people what I do. Now it's a little bit more different. Now I show multiple people what I do
right,
on a
on a
bigger scale.
daily basis, right?
Right. But nonetheless, it's still a big passion of mine to show people. And so if there's people who are interested in learning about ocular ultrasonography, I mean, we do have very specific ophthalmic groups that allow for these courses, such as the Ophthalmic Photographer Society or JACOPA, which is the Joint Commission of Allied Health Professionals in Ophthalmology. They're also the ones that credential any kind of ultrasound related certification, things like that. They also offer courses and workshops for people who are interested in learning about ocular ultrasound. Me being one of the few that know ultrasound or ocular ultrasound in very detailed manner, I'm also one of the instructors that will do either the lecture component or workshop or sometimes both. And so I'm always very happy to see people who sign up for these courses because it it, it brings a nice warm feeling like, hey, someone is actually interested in what you do. You know what I mean?
Yeah. Yeah. So that's exciting. So would they contact you or they contact the accreditation process?
They typically go through the accreditation people or the society because they're the ones that post these courses.
Okay.
Uh, I'm more than happy to guide people in the proper direction and channels, but typically that's point one.
And so tell us what that accreditation name is again.
It's the Joint Commission for Allied Health Personnel in Ophthalmology,
Okay.
or JCAPO for short.
The capo. Yeah.
And then one of the other societies affiliated or that works hand in hand is the Ophthalmic Photographers Society. They do more of like digital imaging of the eye or digital diagnostic imaging of the eye, but ultrasound being a diagnostic imaging modality will also kind of get lumped in with them and we'll do multiple courses where people can learn all types of cool techniques for imaging the eye.
Awesome. So the image itself then looks like a grayscale image
Yes,
for you as well. Okay.
absolutely. Yeah.
So the image isn't, and is it more of a laptop machine or is it larger than that?
I'm glad you asked that. So we, the company that I'm with, LumiBird Medical, we have two. We have a iPad looking one that's it's actually called the Compact Touch, where it's very portable. You can carry it from site to site. Of course, it's limited in probes, mostly the B-scan probe, which is your typical 2D image grayscale.
Okay.
But our bigger one called the Absolute, where we have two B-scan probes to image the orbit or very fine details of the intraocular structures or even the front of the eye. That one's a little bit larger. It looks more like a bigger computer, on top of a nice little stand. While it is mobile, I don't like moving it around too much because it's so detailed and it has all the probes available and I mean you can move it, but I'd rather people didn't. I'd rather it be stationary.
Yeah. Yeah. That's fascinating. Well, that's another option for us as ultrasound people, right? To
Yeah,
go into
definitely,
that and
definitely.
learn more about it. And so if anyone has more questions, I'm sure Jeff wouldn't mind you messaging him LinkedIn or other ways to get a hold of him through his company. And thanks so much for sharing your message. And
Thank you, thank you.
I can tell it's your passion, and I love it that you're so about it, right?
Thank you, yes.
Brings joy, right? It brings joy to you and to others, and then you don't mind doing your job, right?
I
When
love what I do. I love what I do. Yes.
yeah, and then it's more of a passion. So um yeah, we're just so grateful for what you do and for your specialty and for your experience and being willing to share that too
Well,
and
thank you.
and
Thank you so
teach
much.
others. We definitely need those mentors to pass things down to others. Uh
Absolutely. Yeah.
teach us. So thank you for doing that.
Thank you. Thank you.
Thank you for joining us. And we will talk with you again.
Oh, thank you so much. It's been a pleasure.
Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.